This video is over the psychiatry chapter. We skipped a couple chapters. You'll notice we skipped radiology and nuclear medicine. That's because really, if you think about it, radiology and nuclear medicine and testing has been a part of almost every chapter so far. And then we also skipped the pharmacology chapter because really in any kind of health program, medical or allied health program, pharmacology becomes a whole separate component in course usually for you, so we can skip it in this text. So the last chapter we really need to go through then is psychiatry. So the introduction is listed here at the very beginning of your chapter. You know, it's very different from the others in this book. It goes on to say, you know, some but not all psychiatric disorders are not readily explainable in terms of abnormalities in the structure or the chemistry of an organ or a tissue, as like other illnesses, you know, probably are. We do talk about psychiatrists. Psychiatrists, it says, complete the same medical training as other physicians, and they receive their MD or their OD, and then they spend a variable number of years training in the methods and practice of psychotherapy. And then if you scroll down a little bit further, a psychologist is a non-medical professional who's trained in methods of psychological testing, therapy, analysis, and research. So psychiatrists, I kind of have a note here, you know, they diagnose, okay, the problem and the issue. A psychologist is more about studying, okay, testing and studying the problem or the issue. Psychiatric clinical symptoms are talked about. There's some very basic and common terms here: amnesia, anxiety, apathy, compulsion, conversion, delusion, dissociation, dysphoria, euphoria, hallucination, labile, mania, mutism, obsession, and paranoia. Those are all very good terms for you to review. We go into some phobias, a lot of anxiety type disorders. That's a good paragraph for you to read through. And then bipolar type disorders, depressive type disorders, dissociative disorders, eating, neurocognitive type disorders, neurodevelopmental, personality type disorders, schizophrenia, sexual dysfunction type disorders, and somatic symptoms, and then substance related or addictive type related disorders. Really, table 22.1 is a great catch-all. It's a very good all-inclusive table for you that gives the category of the type of disorder and then the examples. Then we go through therapeutic modalities, things and treatments that we do. Psychotherapy gives you a lot of different instances there. Drug type therapies, there's a lot of instances there. And then we get to our vocabulary, which is quite a bit because it's a pretty heavy chapter so far. And then our blue boxes. So when we get to combining forms here for the psychiatry chapter, we're looking at anxio, auto, hallucino, hypno, iatro, mento, neuro, philo, phreno, psycho, schizo, somato, and then we have some suffixes here: genic, leptic, mania, phobia, phoria, and thymia. And then we have some prefixes a and an, which of course we know means no, not, or without, and cata, hypo, and then para. So really make sure that you pay attention to your blue boxes, make those flashcards and study them. Table 22-2 gives a great kind of synopsis there of all the phobias, okay, and the medical term for them. It's kind of fun to look through those and say some of those words. And then the abbreviations, and it's the end of the chapter.